Welcome everyone. Today we're going to completely change how we think about heart attacks. We're going to trace the journey of an atherosclerotic plaque from the earliest microscopic changes in the arterial wall all the way to the dangerous vulnerable plaques that cause sudden cardiac events. Let's dive in. For decades, we've treated heart attacks like a simple plumbing problem. We pictured plaques slowly building up like gunk in a pipe until it's totally blocked. But that old theory doesn't explain how someone who seems perfectly healthy can have a massive, sudden heart attack the very next day. To find the real culprit, we have to toss out the plumbing idea and zoom way in on the artery wall itself. It begins in the intima, the innermost layer of the artery. Sometimes this layer thickens as a normal physiological adaptation to the mechanical stress of blood flow. But atherosclerosis is a fundamentally different process. It is a pathological chronic inflammatory disease. The key difference between a normal adaptation and a dangerous disease, it's lipid retention. When lipids get trapped in the arterial wall, a hostile environment begins to form, leading to the atherosclerotic process. The true start of the disease process is endothelial dysfunction. The endothelium is a super thin, delicate lining inside your arteries. In a healthy person, it's smooth and protective, but when it gets injured, it loses its barrier function. It's like the artery's own security system has become rogue. Macrophages try to consume the oxidized LDL that has infiltrated the vessel wall, but they gorge themselves and become foam cells. These bloated, lipid-laden cells gather to form a fatty streak. Then macrophages act like tiny demolition crews inside the artery wall, setting up the stage for a highly unstable plaque. As the artery tries to heal, smooth muscle cells form a protective fibrous cap over this lipid core. A stable plaque has a thick cap, and an unstable plaque has a very thin cap. The vulnerable plaque has lipid-laden core under it. The stable plaque does not have a lipid-laden core.